Welcome back. Here's a look at the latest COVID-19 figures in the country. There have been 22,910 new infections. 460 more people have died, bringing the death toll to nearly 63,500. Gauteng recorded over 11,700 new infections, followed by the Western Cape with more than 2,500. 711 more people have been admitted to hospital in the past day. Well, the new Lambda Covid-19 variant has not been detected in South Africa just yet, but the Delta variant is spreading through the country pretty fast and it's causing havoc. Professor Adrian Puren from the National Institute for Communicable Diseases joins me now live. Prof, thanks for your time. We appreciate it. You know, just looking at the latest figures, we were hoping to see a decline in the past couple of days, but it's not looking very promising, isn't it?
Not at this time, but I think we just need to keep an eye out over the next few days as well to determine whether or not, at least for Gauteng, whether or not we're going to reach a peak or whether the trajectory is going to be onward. But we'll see over the next few days, I'm sure, whether or not there's going to be a turn. Of course, the other concern, of course, is the Western Cape, and that's an upward trajectory there as well in terms of cases. However, I think other concerns are around some of the other provinces which have ongoing transmission, and therefore the incidence is still somewhat substantial and intensive. And if you look at a positivity rate in Limpopo, where almost every 1 in 2 persons that presents for testing is positive, certainly highlights that concern. I think there is capacity to do more testing, and I think we should really ensure that testing is increased, or at least that the numbers are increased, in order for us to get a better sense of what's actually happening within our provinces.
Yeah, so we have over 15,000 people in hospitals, and this number is set to grow because we're seeing more in people needing to be hospitalized, and that is because of the Delta variant, is it? Because of how it spreads so fast and the effects of this variant?
Absolutely. So I think there's that association that, in fact, as your numbers increase in an absolute way, the outcome of that is that proportion, although it's a significant proportion of people, then certainly end up in our hospitals requiring bed capacity, requiring oxygen. So that puts a substantial strain on our hospitals. And I think we've seen some of the headlines. We've certainly, from our families and anecdotes, have certainly noted those experiences that patients are currently experiencing. So I think, again, there's a great need to determine within the provinces how to manage that. And I think each province has its own resurgence plan. So I think Gauteng in particular, I'm sure, is certainly trying to determine what are the best ways to manage this. If it does not require high intensive bed capacity, what are the alternative solutions? And of course, the other provinces, such as KwaZulu-Natal, Eastern Cape, although they are experiencing increases in numbers, again, it's important for them to have their resurgence plans in place. In particular, as you noted, that this new variant certainly leads to a substantial increase in the numbers. And as you've certainly observed, is that's already outstripped our second resurgence. So saying, again, I think we just need to be careful what the trajectories are, given in the presence of this particular variant. But it may well be that if the trajectories are still relatively flat, the actual outcome of this particular resurgence may well look different and may well, in part, match the models that were predicted or in particular scenarios.
Are you expecting it to increase at all, though, given the rate at which people are being infected over the past couple of days? Because we saw it, at 26,000, we saw it drop a little bit for 2 days, and now we're back up again.
Yeah, so I think it's going to be a mixed bag. In other words, I think if you look at, for example, Northern Cape, although it has high incidence, it certainly is on the decline, but there's ongoing transmission in the Free State and in the Northwest Province, for example. And the Western Cape is certainly, slowly but surely, having an increase in its particular trajectory, whereas you look at KwaZulu-Natal and Eastern Cape, certainly there's an upward trajectory, but very different to what we saw in the previous cycles or resurgences. Yes.
Level 4 restrictions were put into place almost 2 weeks ago. The president hoped that would see a decrease in the infection rate. Has it been effective at all?
Well, I think I think it's pretty close to the 11th hour, or the 11th day, rather. So I think they may well have to look at all the data, what it's showing, what the likely trajectories are, in order for them to make a decision whether or not either to extend or to hold off or readjust to a level 3. But I think it really just depends on the numbers and the likely projections that are likely to come through over the next few days, I'm afraid.
So let's talk about this Lambda variant. There were some concerns that it did reach South Africa, but government is saying that's not the case. What are you finding?
Well, I can confirm that we, in terms of the sequences that we've currently been doing recently, that there's no evidence for that. Obviously, there are lags, but my sense is that the current data, which is probably about a week in terms of a lag, does not show any indication of the Lambda variant. In fact, I understand that there is no evidence of Lambda in the continent as well. It's certainly been demonstrated in about 30-odd countries. So it is a variant of interest because it does have mutations similar to the mutations that we've seen in the Delta and the Beta variant in terms of immune escape, as well as increased transmissibility. So those are the concerns, and given that it's widespread and caused large outbreaks in some countries in South America, that is of concern. And of course, I think there's a preprint from Chile, for example, which, as you know, has the Sinovac. And I think the preprint certainly indicates that in terms of vaccine effectiveness, that it's not as effective, the vaccine, that is, not effective against this particular variant. So I think that is of concern. Were we also to introduce it, and were this variant to appear on our shores.
And Prof, lastly, how do you actually look out for specific variants? Because I went for a test last week Friday because I showed some symptoms. I was in contact with someone. Luckily, I was negative. But I was wondering, how do they tell whether I have the Delta variant or the Beta variant or Alpha? Like, what do you look out for? And are you looking at the tests specifically that are conducted to see if those variants are active in the country?
Yes, so currently in South Africa, as you know, we'll both be doing antigen and PCR testing. And so what happens thereafter is that specimens are randomly selected from the different clinics and or hospitals. And these are then sent to central laboratories that form part of a network within South Africa to do molecular characterization. In other words, it's called sequencing. So they're really looking at the code, the mRNA code within these particular viruses, and that based on the code, you can then classify whether this is a variant, and if it's a variant, where does it fit in within the scheme of variants? Is it the Alpha, the Lambda, the Beta, and so forth? So it may not be your specific sequence that will be tested if you were positive, but it's certainly a random selection. And this is done and we've been really trying to scale up the capacity, the order for us to test more, because the more you test, the more likely you are able to detect variants. But so there's great effort to ensure that we can try and generate this result as fast as is possible. There's always going to be a lag, but I hope that there'll be sufficient time, for example, to identify what variants and what the changes are in variants, at least on a weekly basis, in order for us to act. I think the response to the variants is really around what is the level of transmissibility, immune evasion. However, given that we have vaccines, that's going to be critical. But also because we're still relying on NPIs, that's not going to change that particular process. In other words, we are still expected to wear masks, still do the physical distancing. So from that particular aspect, those particular points will definitely not change. You
mentioned vaccines, so this came to mind because I've had so many people ask me about this, and I obviously am not an expert, but people think we are because we're questioning experts. The question about vaccines and why they can't be given to people who currently have COVID-19, and how long, if you have it, do you have to wait before you can actually be vaccinated? What are the answers to those?
What are the answers to those? Well, I can't always give you some definitive. So in terms of if you're experiencing the symptoms of COVID, then there's obviously an immune response already in place. The addition of a vaccine under those circumstances is not going to really potentiate it. However, what has been demonstrated is that persons who have had previous infections and then vaccinated at a later time point, certainly their immune responses are certainly potentiated. So I think there's a good reason, even though you may have had COVID, it's a good idea still to be vaccinated because of this potentiation. Now, the question is around, and again, there seems to be certain uncertainty around this, but I understand that at least 30 days was one position around when to vaccinate. I know that for at least flu vaccine, it's about 2 weeks. But in terms of COVID, I think 30 days has been one recommended period between getting your vaccination.
All right, thank you so much for your time and your insight. Always a pleasure to talk to you. It's so insightful. Appreciate it. Professor Adrian Puren from the NICD.